Hi, I want to talk to you about cocaine as part of my presentation on street drugs. And I've written something here that don't do it, it kills very fast. Please don't do it. Cocaine was once upon a time a good agent for anesthesia and it relieves fatigue, but the danger associated with it has led to laws in many countries and against its usage. It is the strongest stimulant ever known. Crack cocaine is the name given to the solid form of it, and freebasing is what they call the inhaled form. It could be taken either per oral, some pass it through the rectum, some could inhale it, or given through intravenous route. Effects of cocaine. Cocaine increases serotonin and catecholamines like dopamine, norepinephrine, and epinephrine. It stimulates alpha and beta receptors. That is why when there is high blood pressure secondary to cocaine ingestion, we don't give beta selective blockers. We don't give beta 1 selective or beta 1 and 2 only, but we give what could block both alpha and beta receptors, like labetalol. It increases dopamine level, and that will lead to addiction. That's why most people taking it are addicted. It increases serotonin level, and that leads to euphoria. When glutamates are increased, there's concomitant increase in excitement level. On cardiovascular system, it increases the blood pressure, increases heart rate, and increases thrombus formation. As a matter of fact, it's a culprit in myocardial infarction. Cocaine could also cause seizures or increases the possibility of having seizures in those who are already diagnosed with seizure disorder. There's possibility of chest pain, like I've said, could lead to myocardial ischemia, high blood pressure, even aortic dissection. There's possibility of shortness of breath and transient ischemic attack has a warning to a stroke, and of course, could actually come down with ischemic stroke. Cocaine could lead to a very serious condition cause of arachnoid hemorrhage from vasoconstriction. And when that happens, the individual sovereign will make a kind of description saying, this is the worst headache of my life. And the next thing to be done is CT of the head. And when that diagnosis is made, appropriate referral will have to take place immediately. There's possibility of hypothermia, the temperature will rise, the heart will suffer a kind of cardiomyopathy, dilated cardiomyopathy that could lead to arrhythmia on its own, could lead to heart failure, could lead to death. There's possibility of headache, particularly some arachnoid hemorrhage, will lead to thunder clapping kind of headache and the worst headache of his or her life. If it's a pregnant woman, there's possibility of abortive placenta. Abortive placenta usually happens in very high blood pressure, and like I said, cocaine can give that. And of course, the person can lose consciousness and become comatose. From there, if no appropriate interventions are embarked upon on timely basis, the individual could die from it. So, death possible with the use of cocaine. And I've said it repeatedly in the previous presentations that most of these drugs are actually adulterated. They are laden with other street drugs that are not known to you when you get them, or some actually look for those that have been laden or adulterated with other ones. Yes, adulteration, like I've just said, many agents have been added to the main substance. For example, if cocaine has been laden with fentanyl, there could be respiratory depression, and levamisole will give what we call a granulocytosis or cutaneous necrosis. Some cocaine have been packaged with that, and when clenbuterol is packed with cocaine, then there's hypokalemia because um, beta 2 agonists will send potassium into the cells, not in the circulatory system. How will you detect this? You can do that by doing toxicological screening. You do glucose to know if this person is hypoglycemic, rule out pregnancy in this woman, complete blood count, renal function test, that is blood urea nitrogen creatinine, electrolytes, and liver function tests. Do everything, make sure there's no bleeding profile here, INR, APTT, albumin, and bilirubin, all assay. Benzoecgonine, BE, could be detected in urine, saliva, and tears. You can do EKG to rule out any arrhythmia, myocardial infarction going on in the heart, and CT of the head if subarachnoid hemorrhage is suspected. Okay, here is the trouble. This man has taken cocaine, is now suffering, sweating profusely, hypothermia, high blood pressure, and all the likes. Okay, what are you going to do? We're going to help him. We admit. We're going to observe for about 8 to 12 hours, set up IV fluid, give benzodiazepines, but no beta selective agents here. Okay? However, in the next few seconds, I'll tell you more the condition under which you can use beta blockers. But just hold that for now. Then you can give your nitroglycerin, check the blood pressure very well, where it's going to be high anyway. You can use phentolamine. Phentolamine is going to block the alpha receptors, and you can then combine that with beta blockers. So if you have phentolamine at hand and you have your beta blockers at hand, then you can use them together. But watch the BP because both of them will work on the BP and bring it down. And I don't want you to crash the BP down just like that. But if you don't want to use two medications at the same time, you can use labetalol or carfentanil because they block both alpha and beta. So no beta 1 selective or just beta 1 and 2 alone, because when you do that, you give more room to the alpha to continue its own action.